And we are finally at the hour. So welcome everyone. Thank you so much for joining us tonight. My name is Ashley Ferreira with the IMMUNODEFICIENCY Foundation, and we are excited to have you here for tonight's forum, COVID-19 Updates for Individuals with PI. So thank you for all of you joining us from across the country. However, I understand that we have some individuals from outside the country. So if you are not from the continental US, please send us your name and location. You can send that to me, Ashley Ferreira, or to Elizabeth Ferguson. We definitely would love to give you a shout out because we are excited that we are reaching out to people from outside the United States. So please send that to me. So with that, I am going to now pass it over to John Boyle, our President and CEO of IDF. Hi, John.
Hi, Ashley, and thanks for the introduction there and all the good housekeeping. And hello to everyone out there in Zoom land. On behalf of the IMMUNODEFICIENCY Foundation, I'd like to thank all of you for joining us here today for our forum here. Now, we know that it's been quite an ordeal and a journey for many of you here, and which is why we're particularly glad that you decided to come out. And we're also thrilled that our presenter today, Dr. Patel, is able to join us, as well as our exhibitors. The entire community comes out for these wonderful events. So I know that we've got a number, and I would say growing number, of return attendees. So welcome back to all of you. You know what you're in for, and you know how to submit your questions, so excellent. It's always great to have you here, but especially for our new participants, welcome, welcome. We are really happy to have you here and that you found us. And for those of you who are new, just know that as you see all these different words here on the screen, these really are the guidelines for how IDF conducts these forums, as well as all of our other programming. We really want to have, as it says there, a community that's empowered by advocacy and research, and especially education. So it is, we really believe that in providing experts like Dr. Patel and others to you, you can not only help yourselves, but you can help other members of the PI community that maybe that we have not even reached, because we're all in it together. And so, these issues of really using technology to create an opportunity for everyone to learn is really what it is all about for us. So again, we are thrilled that you all made it here and are on this journey with us. So now, before we go any further, I would like to thank the sponsors of this event. This includes our core service leaders, CSL Behring, Grifols, and Takeda. Our core service sustainer, Horizon Therapeutics. Our national sustainer, Accredo. And our national patrons, Diplomat Specialty Infusion, Kedrion Biopharma, CVS Specialty, Quorum CVS Specialty Infusion Services, Koru Medical Systems, and Kava Fusion. All right, well, once this meeting is over, it will eventually end and you will go on to dinner and seeing loved ones and things like that. The learning does not have to stop. We have an enormous number of resources online. You can find them all ultimately by going to primaryimmune.org. If you're not familiar with it and new to our community, go plumb the depths. There is so much to learn there. You can also see our publications, find out about our online support groups, get updates about other upcoming events like this, get help with issues that are plaguing you, like insurance, and all sorts of different things. You can also connect with us on social media to keep up to date, because we believe that the more ways in which we are in contact with one another, sharing news, sharing information, the better. So any of the social media platforms you're on, well, we're not on all of them, but we're on all the big ones. So I really hope that you will keep in communication, because we see it as a two-way street. So with all that said, and before my voice gives out, I would like to say thank you. Thank you for being a part of our community. Thank you for being here today. Thank you for deciding that you want to learn and maybe spread awareness of what it is that you learn with members of your family and your community. And just know that your participation in this event and really everything else that we do helps us to know what it is that we really should be doing, where your needs are. So when we know what your needs are and your interests are, it helps us program for the future for those who may be diagnosed tomorrow. So thank you in this strange time and with this new normal for being part of our community and for giving my colleagues and I an excuse to get our voices warmed up in the evening. So without further ado, I would like to now invite Sean McCabe from Takeda as one of our sponsors for a quick word. Sean?
Thank you, John. And a sincere thanks, I say it every time, and I mean it every time, the IDF, the whole team adapting and creating this phenomenal environment of education and support for the community. Also, a sincere thanks to Dr. Patel for doing the same, supporting the community and being a hero to so many, the whole HCP community in these times. So a great pleasure to be joining you tonight. By just way of very brief introduction, Sean McCabe, have the pleasure of leading the immune deficiency franchise at Takeda. If you're not familiar with Takeda, you may be with the prior companies, Baxter, Baxalta, Shire, and to Takeda. We've worn multiple jerseys over the years. But nonetheless, as the companies change, the commitment to supporting patients with these great therapies will always remain. And if you don't recognize the company, the products that we support, we proudly offer GammaGuard, HyQvia, and Cuvitru. But in the spirit of this, we're not here to talk brands. We're here to listen in terms of trying to support this community. It starts with that. And so looking forward to the breakouts to address any questions you may have. I'll be joined with my dear colleague, Dana Fladhammer, who leads the community support team and my IG source. So looking forward to not only the education, but also engaging thereafter. Thank you.
Thank you so much, Sean, for your words. Thank you, John, for that welcome. Quick shout out to Victoria from Scotland. Thank you so much for being here with us. We're so excited. We really appreciate you joining us. I bet you it's late over there, so thank you. Now, without further ado, we will go ahead and get into our presentations. Quick disclaimer, IDF understands that the COVID-19 pandemic is a rapidly evolving situation. We encourage you to check your health department for guidance. The Immune Deficiency Foundation is here tonight not to serve as medical advice or as a substitute for medical advice, treatment, diagnosis. Instead, we're here as a resource to provide you with information that will be helpful for you. And so we appreciate you being here tonight. With that said, I would now like to invite Dr. Patel to please speak. Dr. Niraj Patel is a board-certified allergist and immunologist in pediatrics who serves as a director and founder of the Immunology Clinic at the Levine Children's Specialty Center, where he treats pediatric and adult patients with primary immunodeficiencies. Thank you, Dr. Patel, for being here, and I would like to now hand it over to him.
Great, thank you, Ashley, for that kind introduction. I am very excited to be talking about COVID and updates for individuals with primary immune deficiency. I just want to put a shout out to Colleen Brock and the IDF for putting something amazing together in a virtual world. Only the IDF could really pull it off. I think last count there was over 160 registrants for this talk. So it really points out the fact that people are interested and are looking for guidance and it's a sign of the times. So kudos to the IDF. Again, in my own personal background, infectious disease and allergy immunology, being boarded in both has been an advantage and exciting during this time. I get to be on the front line, taking care of patients, including patients who are COVID positive and patients with primary immune deficiency disease. So, we're involved in clinical trials for COVID-19, the remdesivir trial. So it's sort of all in, and I've got a lot of support along the way. So super pleased. I'm really excited to present some updates for you, and I can't thank IDF enough. And also, I just want to let you guys know, thank you for taking the time out of all of your all's busy schedule. I mean, everybody's busy these days, You know, it's not easy to find an hour, hour and a half in your busy time. People have family, school for some are still in, and so it's hard to just find the time. So thank you for making the time and making the effort to take care of yourself. So with that, we'll begin. So just some background. This talk really is going to be a little bit brief on the coronavirus. That's the first part. The second part is going to be focused on more on updates for primary immune deficiency disease. And I think the reason is because a lot of this information now is not new. And so we'll briefly touch base on some things. And I expect a lot of this to be known, but may pick up a few things that are not. So coronaviruses in general, not just COVID-19, but in general, are a family of viruses, and they can cause diseases in humans. Obviously, with things that you already know, respiratory tract infections are probably the most common presentation. And what's scary about COVID-19 is that most folks lack immunity, and when you lack immunity to an infectious agent, it can really cause and progress to severe infection, and in this case, respiratory infection, respiratory failure, pneumonia. The incubation period, so the time it takes from the time somebody acquires the virus to the time they display symptoms, is generally about 2 to 14 days, but in most people, it's usually around 5 to 6 days. Now, what you may not know is that coronaviruses have been circulating seasonally for the last several years, and there's 4 major coronaviruses that are not COVID-19. And it's important because there's tests for these, and oftentimes people will get labeled with coronavirus, but this is not necessarily SARS-CoV-2. For right now, unfortunately, most of the things that we can do for coronaviruses, and in particular COVID-19, is supportive care. We'll talk a little bit about what the most recent advances are, but in general, there's no definitive treatment recommended. And unfortunately, there's no current vaccines, but I'll give you a landscape of where we are with vaccines and when we might expect something. So I think most of you all know that COVID-19, the first cases were reported in Wuhan province in China. The first week, this is clinical presentation of another name for COVID-19, SARS-CoV-2. Generally is muscle pains, fatigue, cough, and low-grade fevers. And generally in the second week is when you start to see worsening severity of illness. And obviously the most worrisome symptom, or one of the most worrisome symptoms, is shortness of breath. And that's really what clues people in that this may be related to COVID-19. Again, you know, the symptom onset is generally around 2 to 9 days after exposure to somebody with COVID-19. But the average is about 5 days. And what you may not know is that the majority of infections with COVID-19 are actually mild. 80% are mild, which generally means people don't require oxygen, they are not on a ventilator, and they recover typically without incident, often without seeing a medical provider or without hospitalization. Some folks go on to develop bilateral pneumonia, and sometimes it can be difficult to discern whether this is just COVID-19 or whether there's something else like a secondary bacterial infection. What we don't know a whole lot about is viral shedding. I think this is a question that comes up pretty commonly. You know, how long is somebody infectious after they have COVID-19? And you know, the data we have right now is unclear, but there is some data to support that viral shedding can occur 1 to 4 weeks. Whether that's patient is infectious the entire time really remains to be seen. And I'm going to show you some data that is pretty reassuring with children who have COVID-19. So this is sort of getting a little bit scientific, but I think it's important to know characteristics of severe COVID disease. When somebody has COVID-19, about 15 to 20% of adults who are infected get severe disease, and I should have spelled this out, acute respiratory distress syndrome, or ARDS. This is a bad, bad lung disease. Most of these folks are on ventilators, and you can see here that 5% are in critical condition. Just to let you know, really one of the first studies that came out on critical disease of COVID-19 showed that really it was older individuals, average age of 16, but more commonly older than 65. Typically, I mean, there's a lot of things wrong with men in general, but this study did have a slight male predominance. And it just goes to show you that, you know, the COVID-19, number one, can affect multiple organ systems. So there's not a lot of organs that really can be safe. So kidney, liver, heart, about 15% had a hospital-acquired infection. And the death rate really seemed to be higher in those who are older, age 65, and then in those with comorbid conditions. And I'm going to talk a little bit about comorbid conditions because, you know, there's more and more coming out about what is immune deficiency, and in particular, you know, what do we know about primary antibody deficiency and other immunodeficiencies. So what about children? There's also been a recent update, I think, that some people have been asking questions on. So you can see right away that compared to 15 to 20% of severe disease in adults, children don't seem to be affected as severely or as common. Only about 6 to 8 in one of the first reports that came out of China of children who were infected with COVID actually developed severe symptoms. What is newer information in the last several weeks is something that is seen more commonly in children than adults. And these are reports coming out of US and Europe. And it goes by many names, but I think people are settling on multi-system inflammatory syndrome in children, or MIS-C. And that really is a sort of a new spin on a previous old disease. And that old disease, or somewhat common disease in pediatrics, is something called Kawasaki's disease. And Kawasaki's has nothing to do with the motorcycle. They're not little kids running around unsupervised on motorcycles. But what it is, it's a syndrome where kids present with fever, and they present with signs and symptoms of inflammation. So they may have red eyes. They may have swollen, cracked lips. The problem with Kawasaki's disease is that they can go on to develop severe symptoms, including shock. They can have dilation of the vessels that supply blood to the heart. And what's been recently associated with Kawasaki's disease, again, Kawasaki's disease has been around for decades, but the association of COVID-19 and Kawasaki's disease is something that's being more commonly reported. And so this is something that's new in the community. We're still learning a lot of information, and most academic institutions are developing protocols, including our own. So again, more to come on this syndrome. So what I want to touch upon is who is at higher risk from COVID-19. And I want to make a distinction. Higher risk means higher risk of morbidity and mortality. We're not talking about higher risk of transmission. Really, it's once you get COVID infection, who is more likely to not do well. And those would be older adults, typically older than 65 years old. And then in general, chronic medical conditions. Now, if you asked medical professionals 2 months ago, maybe in March, chronic medical conditions meant a lot of things. It meant folks with heart disease, those with high blood pressure, diabetes, lung disease, including asthma. And then here's the kicker, is immunocompromised. And I've got some more information about immunocompromised, about what that means and what it really means for immune deficiency patients. These are, genetic primary immune deficiency patients. So I'll come back to that. But again, I think we're still learning a lot more, but I want to focus on that. It may not necessarily be that depressing for patients with PI. So what about transmission? I think there's a lot that have gone into transmission. And, my take on it is the more we know, the more we do not know. And so, there is constantly things that are coming out. We're going to talk about reputable, websites and sources, because there is a lot of misinformation. But in general, droplet and contact. So sneezing, coughing, those are the respiratory droplets are the primary method. There's currently no evidence that you can get transmission from pets or animals. I know that was a question. Close contacts are most at risk. So these are household contacts. Obviously, those are within 6 feet for a prolonged period of time. And then, really unprotected direct contacts with secretions, like somebody is coughing, somebody is sneezing. And then we talked about the incubation period. On average, it's about 5 to 6 days from the time of transmission to the time of symptoms. Milder symptoms, this is where it gets a little bit confusing, but may cause issues with detection of cases within a 14-day time frame. And what we're learning a little bit more about is asymptomatic carriers. I think this is really scary because even though it doesn't comprise a lot of folks who have COVID-19, in fact, one paper estimates it's really less than 1%, although that data was from a time period where we didn't have widespread testing. So, that number may go up, but it really hones in on the fact that we need to keep up our guard. We cannot let down our guard to even folks who appear well, because there is a possibility of somebody being able to transmit COVID with being completely asymptomatic. Testing for COVID-19. This is also something that is evolving. The most commonly used and available testing is nasal swab. So this is a deep nasal pharyngeal swab, the one that feels like somebody's swabbing your brain. But that is the most sensitive way to detect COVID-19. A throat swab is not as sensitive. And really this can detect acute or active infection. Serology or antibodies, detecting of antibodies when you've had COVID infection is a newer test. It's becoming more widely available. And this indicates past infection. It can indicate ongoing infection, but currently it's recommended that it should not be the sole basis for diagnosis of COVID-19, either presence or absence. So we'll talk a little about this because there are some, problems with the antibody test. And one of the problems is that it may not detect, it may not be positive until 10 to 14 days after you develop symptoms. So you could potentially be sick from COVID-19, have symptoms for 3 to 5 days, go and get your antibody test, and it's negative. And that's because you have not produced an antibody to the COVID-19 yet. The other thing that we're trying to muster through is trying to determine how to distinguish between SARS, COVID-19, and other coronaviruses. And there is some cross-reactivity with the antibody test. Who should get tested for COVID-19? I think this is super important. Symptomatic persons. So when testing was first recommended, we started recognizing this was absolutely the gold standard is an influenza-like illness, which is basically fever and cough or shortness of breath. I think that goes without saying. If you have an influenza-like illness, you need testing for COVID-19. But since then, we've learned so much more about various symptoms of COVID-19. And so the CDC expanded symptoms include if you have chills and repeated shaking, fever with muscle pain, with new onset headache, with a sore throat, and new loss of taste or smell. So if you have fever and some of these other symptoms, or one of these other symptoms, then you should really be considered for testing for COVID-19. Also, I'd just throw in there too, there's also other symptoms I didn't mention, gastrointestinal symptoms, and diarrhea and vomiting. And if you have any questions, then you should also use your medical provider as a resource. So what about treatment, right? This has been a hot topic. We get more questions about treatment than almost any other topic. And unfortunately, we still say supportive, and that is the gold standard. And I know what you're thinking, there's not much of a standard because, take fluids, get rest, treat your fever. But there is very intense studies that are ongoing that are really looking. There is some data to suggest that systemic corticosteroids should be avoided. This is a policy that's been supported by the American Academy of Asthma, Allergy, and Immunology and the American College. of asthma, gene immunology, and it really remains to be seen whether this is still true. One of the caveats, or one of the counterintuitive things, is that COVID-19, one of the huge problems with COVID-19 is that it causes an inflammatory problem. Sometimes it's really not the effect of the actual virus. It's the effect of your overactive immune system. And that overactive immune system can cause inflammation, which can cause leaking of fluid out of your blood vessels. It can cause inflammation in your lungs to be on a ventilator. So it's really your own immune system. And you would think that corticosteroids, being an anti-inflammatory, may have some effect of reducing inflammation. But again, the jury is still out on that. I do want to just touch base real briefly on treatment trials. Out of all of the treatments that you've heard of, the one that's most promising is remdesivir. Remdesivir is an antiviral. It basically, for lack of a better context, it basically takes away sugar from viruses, and it doesn't promote replication. So what happens is it's meant for people who have COVID-19, and preliminary studies suggest that you might shorten hospitalization, you might shorten duration of symptoms anywhere between 3 and 5 days. And that really is the most promising. There are several institutions doing remdesivir trials. We're fortunate to be one of 25 institutions worldwide that were picked to do remdesivir. The other ones are still being studied in clinical studies. We also have a study ongoing in other institutions, convalescent sera. So what they're doing is getting folks who have had COVID-19 and then isolate their sera, which presumably has the protective antibodies, and seeing if the protective antibodies helps patients with active COVID-19. So, antibodies, the same antibodies that are present in things like immunoglobulin, help bind to viruses, and for lack of a better term, they work in a couple other different ways, but this could potentially be a potential treatment. Hydroxychloroquine, the trials are really closed at this point, and this is really losing favor, both from a treatment and a prophylactic standpoint. There's a lot more risk at this point than there is obvious signs of improvement. And then there are anti-inflammatory agents, like I mentioned. I won't go into many of them. Tocilizumab is one of them that are in clinical trials, and this again tries and helps control the inflammation, the inflammatory response that your body produces as a response to COVID. The other things that you may have come across, azithromycin, Pepcid, and so many other things that are out there are really unproven as of yet. Where are we with vaccine? That's what everybody wants to know. And it is underway. The beginning in March, it was a phased trial had already been started, which was impressive because when COVID-19 came out, the idea was to have a vaccine in 12 to 18 months. Clearly, that is no longer a due date. It looks like there's several clinical trials that are in progress. There's one in the UK. I think there's one that's being started in the US. And those are involving, I believe, in the thousands of patients. And so there's a couple of questions here. One is, when will a vaccine get approved? I know there's pharma companies who are really supporting some of these clinical trials, which makes things very, very timely. But even when a vaccine is ready, even when a vaccine looks to be effective, then there are other issues too. How fast can it be manufactured? How fast can it be distributed? And we know from previous flu vaccines that sometimes there can be issues, both with manufacturing and distribution. There really has not been a set date on when a vaccine will be ready. There's some experts that suggest that there may be ready by the end of the year. That's pretty optimistic, but I suppose it's possible. Probably more realistic, early 2021. So at first I thought I had COVID because I couldn't breathe, and then I unbuttoned my pants. Anyway, hopefully this is not you and any of your family members, but sometimes I feel like this, just with all of the things that we have to do, our work, homeschool, take care of our kids, put dinner on the table. So now this is a transition to the next topic, next slide. which is getting away from the specifics of virus, COVID, and really focusing in now on COVID-19 and updates on PI. And I wanted to spend the majority of this talk looking at this information again, because people have been talking about COVID-19. We know much about COVID-19. So what about mental health, right? COVID-19 and mental health. It doesn't take a rocket science to figure out that outbreaks cause stress, as reported by the CDC. You can have difficulty sleeping or concentrating. Obviously, this is going to exacerbate issues with stress, depression, feeling of fear and anxiety about your own health, particularly if you have issues with health and primary immune deficiency patients. We know that it can increase the use of things like alcohol, tobacco, and other drugs. So this is not a complete list. These are some things that I pulled from the CDC. You may have your own ways to combat stress, but these are some, sort of some more common techniques. I know, as much as it seems preposterous, you should take breaks from hearing about pandemic. If you're hearing about pandemic 24/7, that is not good. So take a break, listen to something else, do something else. How about deep breaths, stretching, meditation? This can be very, very helpful. And then there are studies looking at improved immunity and keeping the immune system healthy by eating a balanced diet. Exercising regularly improves the immune system, and getting plenty of sleep. And do things to make time to unwind. After this, I have a session with my own family called Rummikub, and we play a board game, at least try to, every night, and it really shows me that I still don't know anything about board games and how to win. And then connect with others. That's super important. I think sometimes you can think about all these things, but connecting with those people who mean the most to you, family members, colleagues, and others. What about COVID-19 and immune deficiency? Lots of questions about this, and I want to just try and give you some updates. So immune deficiency means a lot of things to a lot of people, and what you're going to see on the CDC website, on your state and local health departments, this is a running list of immune deficiency. And some of this doesn't apply to folks here. Bone marrow transplant, and that may apply to a few. Cancer and chemotherapy, rheumatologic diseases, even biologics or certain therapies that suppress the immune system. And then obviously genetic causes or primary immune deficiency disease. Just before this talk, I did a literature search, and I looked for how many COVID-19 articles were published that are associated with primary immune deficiency, and there was an amazing one article. Now, I might be missing something, and there may be articles published, but this one article looked at quality of life in CVID patients. So really, it just goes to show you there really is not a lot out there about immune deficiency, primary immune deficiency, and COVID-19. So, what is known is there's several published articles on other immunodeficiency populations. There's an article that was published on children with cancer, and they did well compared to non-cancer. You might say, what the heck? How in the world is that possible? Somebody with cancer does well, and I think that one of the issues may be because cancer kids don't have a very good functioning immune system. And remember, COVID-19 may exacerbate your immune system, and your immune system is on overdrive. That causes a lot of symptoms. So actually having an immune deficiency like cancer may actually be, somewhat beneficial. Again, this is just postulation. Nobody knows for sure. There was a study that came out that looked at HIV-infected patients and COVID-19. Again, HIV is considered an immune deficiency state, and there was really no excess in symptoms, no mortality. HIV patients, infected patients, did just as well as the general population. So what about special populations immune deficiency, right? So primary immune deficiency patients and those receiving biologics or other immunosuppressive medications. Are these folks at higher risk? And I want to be careful here. I'm talking about higher risk for severe disease. Again, I'm not talking about higher risk for transmission. There's no data that I know of yet that shows that people who have immune deficiency are at high risk for either picking up the disease or giving the disease. We're talking about this being a comorbid condition for developing severe disease. And the jury is still out, even to this day. But I'm going to tell you some sort of anecdotal things of what we know and some up to speed. But really, the main home things, the take-home things that are going to be present throughout this is take certain precautions. If you don't have an immediate need to see a primary care or an immunologist face-to-face, try and work on virtual visits. Work as home as much as possible, stay at home as much as possible. Now, this is going to be a little different, right, with reentry in many states and going back to employment and going back to school. And I'm going to talk a bit more about that. But as much as possible, really ask yourself, is this a critical need, or is this something that can be put off? Now, I heard at the beginning, before my conversation, that somebody's hair, I think, was getting out of control, and they had an urgency to see the barber. And so, but honestly, you really have to make sure that you're taking the precautions. It's really super important to continue all your current medications. You should not stop any of your medications without consulting a physician or immunologist, and that includes immunoglobulin replacement. You should continue immunoglobulin replacement. The idea is you need to keep yourself healthy and as healthy as possible. And it goes without saying that you should seek prompt medical evaluation of sick. If you're sick, then you should touch base and seek medical attention right away. And if this is not ingrained in your brain, then it should be by the end of this talk. Wash your hands with soap and water, or with more than 60% alcohol swab. Avoid touching your face. And I get it. It's hard for certain populations. Little kids are going to touch their faces probably more than they're going to shake hands and do things like that. But the idea is that if you touch something, or you have come into contact with something and you touch your eyes or your nose or your face, put your hand in your mouth, it's a potential portal of entry. Social distancing, and then avoid sick people. I typically tell my patients that they see a sick people, you should just run the other way. And then, wear masks, even still, and that is also including cloth masks. What about immunoglobulin? I thought there should be a slide about this because there's a lot of questions regarding immunoglobulin. And this is not product specific, this is not route specific. So we're really talking about IVIG and subcutaneous IG. Again, patients should continue immunoglobulin treatment if you are on immunoglobulin treatment. Most preparations are really not expected to contain appreciable antibodies to COVID-19. That's what we know so far. So this is not expected to be protective against the COVID-19. Now, there is some suspicion that there may be, in some minority of lots, some cross-reactive antibodies. But really, I've been telling patients they really should not expect to have any protection from immunoglobulin to COVID-19. Again, there's a single study that found cross-reactive antibodies in IVIG preparations. The problem here, and the thing we don't know about, is there's two types of antibodies. One that your body produces and basically just floats around in your body, and the second is neutralizing antibodies. And it's not known whether some of these cross-reactive antibodies that are found in some of these preparations are actually neutralizing antibodies. Neutralizing antibodies are the antibodies that are important in fighting off viral infections like COVID-19. And it's really unclear whether these antibodies are protective, again, against COVID-19. But again, don't be concerned. There are no reports of COVID-19 infection from IG therapy. So you should not be concerned about getting COVID-19 just simply from immunoglobulin. Okay, I think we talked a little bit about this vaccine and where we're at. Again, several candidate vaccines are being studied. Early research trials have been started both here and abroad. And again, when this will be developed is anybody's guess, probably late 2020, early 2021, which would be a record. I mean, this would be record time. People are racing, but there's still other challenges, just besides having a vaccine that works, manufacturing, distributing that. Is going to be yet to be seen. Okay, what about the vaccine in PI patients? Lots of interest in this, right? Where are we with this and what do we know? So we know that some PI patients may not, in general, respond to vaccines. Some vaccines may be okay, some vaccines may be not okay. And this is not for all PI patients. This may just be for a select certain number of patients. So we know that even some vaccines may not develop a protective response. There is some hypothesis and some interest in seeing the significant population have immunity. And that may not come from just natural infection with COVID-19. And despite, almost 100,000 deaths in the US and over 5 million people worldwide, there's really not a lot of people donating immunoglobulin. Only about 38% from the numbers I've seen in the US actually donate immunoglobulin, and even less than that, less than 10% actually donate annually. So you really have to get the majority of people who have immunity, not just people who have had the infection. And so likely when the vaccine becomes available, that is one of the scenarios where immunity can be widespread. And when the vaccine is available, then you really should ask your immunologist or healthcare provider whether the vaccine is right for you. I'll just tell you what we do in my own practice. I'll put this akin to influenza. Obviously for primary immune deficiency patients, we only recommend killed vaccines, not live viral vaccines. And so we don't know whether COVID-19 is going to be a live viral vaccine or a killed vaccine. If it is a killed vaccine, like most vaccines, then I would attribute it to like the flu vaccine, as long as there's not an allergic reaction to the flu vaccine. That in general, we generally favor the administration of flu vaccine for a theoretical protection against influenza. What about reentry? We could spend 5 hours, and I just have over 496 slides left to talk about reentry for the PI patient. So what about, I'm totally kidding. I think I just have a few more slides, but there are a lot of questions really about reentry for the PI patient. There's lots of ways PI patients are going to be reentering. Employment, schools and universities, restaurants, gyms, places of worship. What about medical procedures, dental cleaning? All of these are, and I haven't just, there's a laundry list of additional things, right? Somebody asked about vacation and travel, and what to do about that, right? What to do about social distancing, washing hands, should we still be wearing masks? I will tell you that over the last week, there's been a lot more guidelines on reentry that are available. And I would say, the sites that you should be aware of are obviously cdc.gov and your state and local health authority. And then ultimately, I think it really comes down to having the best knowledge in a conversation, and that often means consulting with your immunologist. So I just want to give you an example of what's out there. So CDC in association has put out a map or guidelines about a type of reentry, and this involves public pools. And so I wanted to just sort of walk you through this just to show you what people are looking at, what kind of measures people are taking. And I think some of these things can be applied to other measures. I just want to also point out that I don't think PI patients need to live in a bubble. I don't think we need to be quarantined for future until somebody tells us that we cannot. I think really, you need to do your homework, and you need to take the necessary precautions to reduce transmission. So a lot of what we're going to be spending the next amount on, and probably a lot of questions that you all have, are things about, reentry. So just looking at this, pool attendees, so these are people that go to the pool, are encouraged to wear face coverings. So this already tells you that people are going out in the general public. So not only just pools, but restaurants, things where there could be potential, less than 6 feet face-to-face contact. Wearing a mask makes sense. Obviously, outside the water and not inside the water. You're not advised to wear a mask inside the water. Obviously, if it gets wet, you need to change your mask. What about group gatherings in the pool, right? Group gatherings should be avoided because of, social distancing, the increased risk for transmission. If they must be conducted, pool crews are encouraged to stagger drop off and pickup times. Let me point out that, I get a lot of questions about, hey, my person has a dental appointment, or hey, we need to know what to do if we have a medical procedure, or hey, I need to know what should I do with going back to work, right? And so here is a good example of making sure you understand that environment, making sure that you are given the appropriate information as well as the appropriate precautions. You know, I would not want to go to a gym, or I would not want to access a pool if some of these precautions were not being taken, if they were not following reentry guidelines. And so obviously, you know, looking at group gatherings, looking at things that are taking additional steps, so staggered drop-off and pickup times. I know a lot of facilities that as they're reentering, particularly, you know, as people do day camps or as people do activities for kids or even for adults, that they're being, you know, people are being dropped off at the front door, and then, you know, you pick up the person at the front door and you get tested with a thermometer before you enter, and you should not enter if you're sick. So things like that. In this particular pool situation, modified deck layouts with spaced out furniture, again, that social distancing, and visual cues for pool lanes, right? So you don't want to be swimming next to somebody who is, you know, not practicing social distancing. And then, you know, there are certain exceptions. You know, in this particular case, lifeguards should not be tasked with keeping social distancing rules. They should focus on water safety. I think that makes some sense. Frequent cleaning of furniture, towels, and pool equipment. And this should go beyond what these facilities used to do. You know, most facilities may have cleaned their gym maybe once a day, or, you know, if you're lucky, maybe once a week. But this really ought to be the focus of areas of reentry, of areas of engagement. And then swimmers are required to stay 6 feet apart from anyone who they don't live with. What about clean and disinfect? Just a little bit more person-to-person transmission of COVID-19. This is where we're really concerned about, you know, getting the transmission from either contaminated surface or from, you know, some other person. I just want to say that there isn't a lot of data on getting COVID-19 from a contaminated surface. We do know that tests have shown that COVID-19 can stay up to 3 days on certain surfaces, but the CDC currently says it is possible for COVID transmission to be from a contaminated surface, but there is not a lot of literature out there or cases where people have touched something and then picked up COVID-19. But that being said, I think especially for this community, I would still continue to practice very much cleaning, disinfecting, frequently touched surfaces. I would pretend that everything is infected, tables, doorknobs, light switches. And I put in there a complete list. You can just Google EPA, Gov, pesticide registry. There's a complete list of disinfectants that are approved for SARS-CoV-2. Some places recommend daily. You should wear gloves and make sure you have good ventilation. Great. Well, thank you. Appreciate your attention. And with that, we will move on to questions.
Thank you so much, Dr. Patel. We appreciate you sharing that information with our community. As a reminder to everyone, if you would like to have your question answered, or if you'd like to submit a question, please submit it to me via the chat. I will try to get through as many questions as we possibly can. We've already had quite a few coming in. Please keep them coming. We appreciate having them. Before we go into our Q&A session, however, I did want to do a quick word from two of our sponsors. We will go ahead and start with Accredo. I would like to welcome Peter Bergen from Accredo.
Thank you so much. You know, this is great. My name is Peter Bergen. I'm a pharmacist, and I'm the leader of the immune disorder team within the Accredo Specialty Pharmacy. So just want to thank the team for being here. I've had the good fortune to have attended some prior events in person, education days, conferences. Just kudos to being able to pivot and do these sessions virtually. And really also for the consistent and constant communication from the Immune Deficiency Foundation in these unprecedented times. Thanks, Dr. Patel. Excellent information. Looking forward to some of the Q&A here as well. And looking forward to talking to everybody in the breakouts here shortly. Thank you.
Thank you, Peter, so much. Next, I would like to invite Dakota Fisher-Vance from Horizon.
Hey everyone, I'm Dakota and I'm on the patient advocacy team at Horizon Therapeutics, and I'm really excited to be here tonight and witness how incredibly adaptive and willing to continue to show up for each other the primary immune deficiency community is. As zebras, you may not be unfamiliar with medical emergencies and having to stay home and sometimes miss out on events, but that doesn't mean it's not hard to feel isolated right now. However, IDF has shown us that through their virtual events like this and proactive communications, that you're never really alone when you're part of the primary immune deficiency community. Thank you to IDF for organizing this event, and thank you to Dr. Patel for that incredible presentation, and thank you for continuing to show up for each other during this really tough time. I'm looking forward to connecting over at our booth.
Thank you so much, Dakota. As a reminder, as they mentioned, we will have a virtual exhibit hall where you can have ask more questions. So with that, let's go ahead and get into our questions. We're going to start off with a few questions that we received in advance. So let's get started. Dr. Patel, question from our audience. How will I know when it is safe to eat at a restaurant, hug a friend, get a haircut, or see my extended family?
Yeah, that's a great question. So, you know, it involves really figuring out some specifics about how to prevent transmission and how to stay safe. So, you know, things like you know, how social distancing is practiced, making sure that you are safe, wearing a mask, gloves if possible. You know, I guess also in terms of making sure that the person who you're interacting with is also staying safe, such as, you know, a barber wearing a mask. And I think that the most important thing is to really try and reduce the risk that you are going to get COVID-19. And so I think that as we see reentry, a lot of places are taking extra precautions, allowing fewer individuals into, let's say, places that offer business, separating tables at restaurants or placing them outside. And so, you know, hand hygiene again, foremost and first, avoiding sick people, and really avoiding your face, touching your eyes and hands, I think would be a good start to being protected.
Wonderful, thank you. Our next question, Dr. Patel, can you provide information on how a person with CVID can best protect themselves if required to work in a public situation like schools, healthcare offices, or offices?
Right, so I think this can be expanded to not just CVID patients, but patients with all types of PI. And I think this is a real concern for people who have been isolated for months and have now been asked to go back and venture out in the community, either by their employer in certain situations or settings. And again, you know, I think finding out as much information as you can about what the situation is like and how this is going to be individual. So what is the setup like? Are there hand sanitizer stations? What practices are being used to practice safe social distancing? How are masks being implemented? Can any of these situations be performed virtually? And I think that comes back to, you know, what is the necessity to do face-to-face interaction or person-to-person interaction? I might investigate ways to hold off on that as long as possible. But again, you know, just like before the last question, I think these are all great questions. You know, practicing aggressive hand washing, avoiding touching your face, avoiding sick people, and you know, avoid touching things that you know are sick, and really try and get an idea of what is the scenario. And I think also this brings up a point where, you know, you can use resources too, like the CDC and your state and local health departments. There are guidelines that have been posted, particularly more recently about reentry, things particular to schools, things particular to employment. And I also think it's helpful to get information from your healthcare provider and immunologist on these questions. They're tough.
Thank you. Our next question, what is the safest way to travel by plane or stay in a hotel with the risk of COVID-19 due to PI?
Stay at home. You know, I think first thing you have to ask yourself is it necessary? If it is, then, you know, whether it's for work or something else, I think figuring out necessity first. If it is a necessity and it's a, you know, you have a loved one who's not doing well, or you have to travel for work, then I think doing social distancing, wearing a mask, finding out from airlines. You know, airlines are taking some precautions themselves. Most of them are doing extra measures like wiping down the tray tables. They're not allowing as many passengers on the plane, so it might be a good idea to reach out to the particular airline or the particular hotel and find out what is it that they're doing. Hotels are taking very similar measures. They're not working with full capacity. Restaurants and hotels likewise are practicing with social distancing. So, you know, when you're in the airport or in the hotel, I think trying to practice social distancing, wearing a mask, washing your hands, carrying some hand sanitizer with you, I think all of these make sense. And then again, you know, obviously trying to reduce the amount that you have to come into contact with things. So I would say if you're traveling by plane, you know, you may want to consider maybe traveling with your suitcase with you rather than letting it go on the little conveyor belt. I think, you know, trying to get in and out of places, to me, makes the most sense. We know that COVID transmission occurs when there is close contact and significant amount of time with contact. But these are, you know, not, you know, these are nerve-wracking issues, and despite doing some of these things, it's still going to be nerve-wracking. But I think you can take some solace, and you can be proactive by really taking actions to do some investigation before you go, and then taking necessary precautions like we talked about.
Okay. Next question. Am I protected from getting the virus if I am wearing an N95 or cloth mask, but others are not?
Yeah, again, this is a great question. So the N95 or cloth mask, you know, is an important way to keep from getting infected. You know, the transmission occurs most commonly when there is a less than 6 foot distance. So, you know, I think keeping your distance from people who are not wearing masks, I think it's just a reality. There are people out there, go to the grocery store, there's people that you're going to see who are not wearing masks. And despite your best efforts, not everybody is going to join in. So my suggestion would be to try and avoid close contact with those folks. If they're people who you anticipate significant amount of interaction, let's say people who are family members coming by, or there's other situations, then I would encourage those folks to don a mask. Again, you know, most of the aerosolization or most of the transmission of COVID-19 that is by respiratory droplet usually occurs when there is some aerosolization. So usually some forceful transmission. So if this is like coughing or sneezing, there really is not any data to suggest that, you know, if somebody breathes into the air and then somebody walks through that you're going to get COVID-19. So I think just, you know, keeping distance and making sure you minimize interaction with people who are not wearing masks, and then encouraging people to wear masks who you anticipate a significant amount of interaction, whether that's your employment, whether it's people who are, you know, family members, so on and so forth.
Our next questions. With beaches and pools opening up, can I go there? And if I do, how do I stay safe? And I did want to add to that a question we received. Would chlorinated pool water kill the COVID-19 virus?
Right. So great questions. I hope that a slide that I had on opening up of pools hopefully was a segue and gave some important information. Obviously, you know, can you go? I think that's, you know, something that you have to investigate. I don't think there's anything to say absolutely no, that you can't make decisions like going to beaches and pools. But I do think that it's important to find out to have some situational awareness. This may be a little bit harder with beaches than with pools. Certainly beaches have already opened up. I'm in North Carolina, and I know South Carolina beaches, Florida beaches. Finding out who is there, not congregating in areas for beaches or for pools. And I think chlorinated pools, you know, while, you know, chlorination does kill most viruses and bacteria, I think the other issues with COVID-19 still mean that you have to be as protected as possible. So again, this would be, you know, social distancing when you're out of the pool, social distancing when you're in the pool. And again, you know, make sure you are practicing aggressive hand hygiene, avoiding touching your face, sounding like a broken record, things like that.
Perfect. Okay. A question about your presentation. Dr. Patel, can you clarify whether HIV/AIDS is a form of PI or rather an immune deficient state?
Oh, yeah, that's a great question, and I apologize if that wasn't clear. HIV/AIDS is a secondary immune deficiency. It is an immune deficiency. It is not a primary immunodeficiency. And let me just back up by saying that there's two types of immune deficiency. One that you're born with, which is mostly genetic, and that would fall under primary immunodeficiency, would fall underneath that. And that's the focus of this talk and the audience members. HIV is a form of immune deficiency. It does not have anything to do with PI or primary immune deficiency disease. It is purely an immune deficiency that is caused by a virus. I think I was using that evidence to point out that globally, with people who have immune deficiency, both primary immune deficiency and secondary immune deficiency, is that we are learning more about immune deficiency in general. And what we know so far is that folks with secondary immune deficiency seem to be doing okay. Whether that pans out to primary immune deficiency disease remains to be seen. I will just say sort of, I do get, I do stay in contact with sort of immunology experts across the globe. And I think that there hasn't been evidence or significant evidence yet that suggests that PI patients, in particular primary antibody deficiency patients, are at a significant risk for morbidity or mortality with COVID. We don't really have any hard data. This is very anecdotal evidence amongst the immunologists taking care of PI patients. So it'll be very interesting, and we do need data to really make sure that what is being seen by immunologists. But that's a great question. So thanks for making me clear that up.
Not a problem. Thank you. So we have actually received quite a few questions regarding our tiny zebras, i.e. those children with PI and resuming school. What suggestions do you have in terms of children being able to return to school, or where should they look for information about whether or not their children are okay to go back?
Yeah, another great question. I think the great questions are ones that are difficult to answer. So a couple of things that you should know is that re-entry does not mean that COVID-19 has gone away. It doesn't even mean that the cases of COVID-19 have gone down. And I think that's a big, that's one of the main things I didn't emphasize, but I would like to emphasize now, is that we are anticipating a spike in COVID-19 cases. COVID-19 is still circulating around. As re-entry occurs, we've already seen an increased number of cases in several states. And so one thing to be aware of is to be aware of your local situation, your state, and to be aware of what is going on in terms of circulation. Are the number of cases of COVID going down? Are they going up? Because when, in most states, schools are coming to a close for the little ones, the little zebras. And so the big question is what to do in 2 or 3 months. The jury is still out, but I can tell you that I can make some comments about what we know now. I will just caveat and say that really the COVID landscape is changing. So, you really ought to pay attention and keep updates and talk with the immunologist, particularly in about 2 or 3 months when kids are going back to school. So number one is that I do not think that patients, little children who have PI, would automatically not be able to go back to school. I'm going to just say that's a blanket statement. I don't think we need to quarantine, but I do think that there is a real risk of transmission, and there will be a real risk of transmission in August, in September. So I don't think that COVID is going to go away by then. And I think most experts believe COVID is not going to go away by then. Again, the places, I'll just mention before, while I'm thinking about this, because otherwise I'm going to forget it, the things that you should use for resources would be definitely your school. You can reach out to the teachers at school, the principal at school. These are conversations that are going in school around now, because I have kids in school. I have a 17-year-old daughter who's going to be a senior. I have twin boys that are 13 that are going to be rising 8th graders. I'm a pediatric immunologist and infectious disease person, so I love kids, and I take care of a lot of kids, and I get a lot of questions from parents who have kids. So, this is an ongoing issue. But first of all, talk to your school, and then you can use reentry guidelines, CDC, state and local health departments, and make sure you keep up to speed. So with that being said, for schools, I think it's super important that I think schools are going to have to figure out ways to have a curriculum that is going to keep kids safe. And what that means is, I anticipate there may be some changes to the way the classroom looks like. And for in-person classroom teaching, this may look like desks that are separated. This may look like kids who come to the front door, get their temperature checked. This may look like hand sanitizer stations all over the place, right? Maybe kids go to lunch and they're sitting apart from each other at least 6 feet. This may mean that people who are serving food are wearing masks. I think these are all important factors that we need to figure out what exactly is going on and how this impacts our kids. Again, I don't think it's an absolute no-no not to send your kids to school. There may be some impact on virtual learning. I think there's a lot of important things that we can get from school. There's not only just learning and academic information, but there's socializing. And obviously we talked about mental, stress, and kids are stressed at home. I have my own kids who are doing virtual learning, and it's like the devil child, they have these little horns now. I don't know if you've seen this, and a little pointy tail. But I think just keeping up to speed, knowing that COVID is not going away, and then really having a conversation, knowing what the plan is going to be. And then ultimately, I think having the conversations with all of those folks, especially with your primary care and immunologist, can be also some added benefit.
Thank you so much, Dr. Patel. We appreciate you taking the time to answer these questions. Everyone who submitted questions, thank you so much for sending them in. We received quite a few. If you have more questions, please continue to send them in. We will try to get them answered online, and if anything, at our next virtual forum, we'll make sure to have these questions answered. With that, I would now like to hand it over to Lori Giampaolo from CSL Behring for a quick word.
Good evening, everyone. My name is Lori Giampaolo, and I am with CSL Behring. I actually work out of our corporate office in King of Prussia, Pennsylvania, and it is an absolute pleasure to be here this evening. I think I attended the first virtual event, so it's nice to be here again with everyone. At CSL Behring, for those of you who don't know the company, we manufacture plasma-derived therapies for rare diseases. And, despite these unprecedented times, we are committed and driven by our commitment to patients, as evidenced, in being here with all of you this evening. And I greatly look forward to the opportunity to engage with everyone when we are in our breakout rooms. And a big thank you to the IDF for organizing this, and thank you, Dr. Patel, for a wonderful presentation and answering so many thoughtful questions.
Thank you so much, Lori. We look forward to seeing you in our virtual exhibit hall. With that, I would like to pass it over to John so he can lead us into the virtual exhibit hall.
Thanks, Ashley, and thank you so much once again, Dr. Patel. Your presentation and then your trying to tackle the interesting but tough questions is what it's all about. And especially, and thank you to all of you who just answered that little poll. I think that's the first time we've asked something like that, and that was fascinating. That was really illuminating. So I know that this is just a snapshot of 100 or so of you, but that is still really helpful for us. So we've had our sponsors talk, and so I want to just take 1 or 2 minutes here to do a little quick plug for IDF before we go into the virtual exhibit hall. We have at IDF a whole host of different resources that I want to make sure that people do know, especially if you're newer to our community, to take advantage of. We have our newly updated IDF Patient and Family Handbook, which came out earlier this year, the newest edition. It, along with everything else, is available for download, and of course, all of the publications, in addition to being available for download, are easily viewable on primaryimmune.org. And also, hey, we're getting a little chance to interact with the chat here, and we'll be able to chat a little bit in our little breakout groups in a moment. But they're staying connected, being able to see each other's faces. Thank you to everyone who has put on your cameras. It really is great in these very isolating times to be able to connect with one another. And IDF does have a whole host of different opportunities for you to connect with each other, including Get Connected groups, of which I believe that there is a Get Connected group in the Charlotte area coming up, and we will put that information into the chat in just a little bit for those of you who are local. Our friend from Scotland, sorry, that might be a little less of interest to you, but still it's an opportunity for folks who are local, and once you are done with quarantine, can connect with one another, hopefully for breakfast or coffee or something like that. Now, if between the materials you've seen and everything else, you still have questions, my colleagues and I are always happy to try to answer questions as we can. Just go to Ask IDF or feel free to give us a call, and we will do our darndest to either answer your question, connect you with someone who can help, and otherwise try to light the way in these rather darkish times. So anyway, I think that is everything, except to do one more thank you to our sponsors. Thank you so much for being a part of this. So thank you to all of you who stayed until the very end here. And that really brings us to the end of our evening. Just really appreciate the fact that you have stuck with us. Hopefully you've learned something. Hopefully you will go and teach someone something else about what you learned here today. We do have more of these IDF forums coming up in the future. Please go to primaryimmune.org to see the full list as we keep on adding them. We have one on Saturday morning, and look forward to seeing a couple of you there, hopefully. But as we saw from the poll, more of you like the evening, so we're going to see who shows up for the morning ones and test that out. So really, until we see each other again or in person, just know that we are grateful to have you as members of our community. We hope that you stay healthy and safe and sane, which is, I think, more the trick these days and everything, because you all know how to do social distancing and keep clean and wash your hands. So one more thank you to Dr. Patel, and Well, I'm going to stop talking, and y'all can just chat amongst yourselves in the chat feature, and look forward to the next time we are all together. Until then, take care. Bye-bye.